I'm Effie Parks. Welcome to Once Upon a Gene, the podcast. This is a place I created for us to connect and share the stories of our not-so-typical lives. Raising kids who are born with rare genetic syndromes and other types of disabilities can feel pretty isolating. What I know for sure is that when we can hear the triumphs and challenges from others who get it, we can find a lot more laughter, a lot more hope, and feel a lot less alone. I believe there are some magical healing powers that can happen for all of us through sharing our stories, and I'll take all the help I can get.
Once Upon a Gene is proud to be part of Bloodstream Media. Living in a family affected by rare and chronic illness can be isolating, and sometimes the best medicine is connecting to the voices of people who share your experience. This is why Bloodstream Media produces podcasts, blogs, and other forms of content for patients, families, and clinicians impacted by rare and chronic diseases. Visit bloodstreammedia.com to learn more.
Hey there, welcome to the show. This is Once Upon a Gene, and I'm your host, Effie Parks. Thank you so much for joining me today. I'm so happy you're here, and I'm even more happy that I get to see some of you in real life very, very soon. We're talking about the Global Genes Week in Rare. It's coming up. It's September 25th through September 28th in Kansas City, Missouri. Please come. I cannot wait to see you and hug you and squeeze you and listen to all these amazing speakers. And the agenda is on fire. So come, register, globalgenes.org, and let me know if you're coming. Send me a message. And if you're like, oh, I'm thinking about coming, or, oh, I wish I could come, can you please send me a message so I can talk you into it? Because there's a million reasons that you should come. And part of them is just being in person and feeling all of that love surrounded you. It invigorates you. It gives you that little extra nudge to continue on. You will make friends and you will just have the best time, I promise you. So if you're on the fence, get off the fence. Go to globalgenes.org and register. So also, one more housekeeping thing. If you love Once Upon a Gene, if anything has ever spoken to you, if one episode just really resonated, if one episode made you do something, can you send it to someone? Can you post it on your social media? Can you leave a rating review on Apple? Please, anything that you do is so helpful. It helps the show grow and reach the ears of so many more people that need to hear it. So thank you. And with that, I'm looking forward to introducing you to my guest today. She's one of those powerhouse moms who was like, what? Nobody's doing anything? I'll take care of that. She's the founder of the TNP02 Foundation. She's a remarkable, brilliant advocate. She's the mother of little Leo, who was born with this neurodevelopmental disorder, and she's nothing short of extraordinary. She's developed an ASO in record time. He's being dosed. He's doing so great. And she's also going to talk about her baby lion project. So I hope you enjoy my conversation with Iwi Shi. Hi, Iwi. Welcome to the podcast.
Hi, thanks for having me here.
Yes, I'm so grateful to learn from you and talk to you. I've seen your name in a couple Crusader groups here and there, so I'm excited to learn a little bit more about your project and your story so far. So can you maybe share a little bit about the journey discovering Leo's condition and founding the TNP02 Foundation?
Yeah, so I think discovering Leo's condition, it's very similar to a lot of the stories you've had on here. We had, an inkling that something was wrong when his brain or his head circumference wasn't growing at the right speed. And then soon after that, he had a seizure when he was 2.5 months old. We got Leo sequenced at Boston Children's and found out that he had this mutation in, the alphabet soup of genes, right? TNP02 or whatever gene it is. And it turns out that it was a very, very newly discovered gene. And so we kind of hit the ground running right away because we have a semi-scientific background and also friends who were very, enthusiastic about helping us out. And so we started, doing a lot of research, contracting for, outside services, and we settled very quickly. And, I know Julia Vitarello has done a lot of work in this area. So we followed in her footsteps and in other people's footsteps in many, many ways. And that's what got us, through most of the last 2.5 years since Leo was born.
Can you maybe talk a little bit about, or maybe inspire families who are listening, who are maybe a little timid to reach out to other people or just don't know where to start in terms of that networking to maybe build off other people's projects?
Yeah, absolutely. So I think, when Leo first got diagnosed, it was just your world comes crashing down on you, right? Like, here's your child, his life is irreversibly changed, and so is yours, and everything you ever dreamed of, that's just not going to happen anymore. And so there's a lot of processing and a lot of like reckoning internally. And it's a really unhappy and I mean, that's like kind of to put it mildly, but it takes a village, and in rare disease it takes an even bigger village and people who really know where you're at. And so I think for Leo, we felt, we can't do this alone. We have no idea what we're doing, but we have a unique set of circumstances, or we have a very fortunate set of circumstances where maybe we can affect change's outcome if we did the right things, right? Because a lot of people warned us right at the beginning that if you work with the wrong groups, you'll spend all your money and you'll waste all your time. And then at the end of the day, you won't have anything, or maybe you'll have some publications, but what you really want for your child is a therapeutic, right? Is a treatment. And so we thought, let's learn everything we can from the people who have done this before, from the people who know, who's effective, who's not, and so on, things like that. So, I mean, there's just so much to learn. You're just thrown into the deep end, right, for rare diseases. And even whether or not you try to develop a drug, you're in the deep end regardless. So, reach out. There's really nothing to lose. I mean, pretty much everyone I've ever reached out to in the rare disease community has been just an absolute gem. So, we're here. We're here to help you, the families. And we have no other reasons, to talk to you other than to try to help you.
Yeah, totally. And aside from all of the other gifts that you can get from Once Upon a Gene, I always encourage people to use it as a Rolodex. And now I'll add Iwi to that Rolodex. So really, if someone resonates with you more or has expertise or is further along, or if, you're just feeling like that's the person you want to reach out to, there's so many amazing people who have already done this work and who are experts in certain areas. So please feel free to reach out to these people. I'm so blessed to have on this podcast so they can share their expertise with you. So Iwi, when you started the foundation, how many patients did you find?
There were, I think, the original paper had 15 patients worldwide. And we found our Facebook group, or, I found the TNP02 Facebook group. And I think only a small portion, maybe 5 to 10 patients were on the Facebook group. So it's really not that many. And, TNP02, like many of these other genes, it's a very heterogeneous set of mutations. So some kids are affected less, some more. It's very similar, to other ultra rare diseases in that way. And it's also, ultra rare. So yeah, Leo is one of 2 kids with his specific mutation. And most of the other ones, they only have one child in them.
Yeah. Well, you've definitely accelerated at an amazing pace, and kudos to you for that, and networking and reaching out and getting the work done. And I know there's an ASO therapy development for Leo. So can you explain the process of developing this and how you connected with Crayon Bio and whoever else helped you sort of launch this?
We reached out like so many families through our personal networks, and one of our friends, or I think she was not a close friend, but once she heard the story and what we were facing, she really got to work connecting us with all manners of researchers and people. And this was a personal friend, and she was in the biotech industry, right? So that's kind of she was kind of the key link, because we had no kind of interest prior to Leo getting diagnosed. We also had other friends who, they just jumped in because they were all parents. All of our friends are in that stage of life where pretty much everybody has kids now. And so they all really fully understood what it is we were facing and what had happened to us. Between Crayon Bio and I think Charles River, we contacted through the network of rare parents, right? So it was it was Casey McPherson and Terry Piravalakis. So, another couple of really great people in this community who put us in touch with Charles River. So I think networking is really important, because they can, people can tell you which company and which labs do really good work, which is not so easy to tell from the outside.
What were some of the key milestones in getting your ASO therapy?
The biggest milestones, I think, were getting through the actual preclinical development. So getting the actual data, and then writing up the IND. was a really big milestone, and getting it submitted was a pretty non-trivial task because the FDA has this process or they have a requirement that if you want to do an investigator-initiated IND, which is considered the much faster path, you need it to be sent in by a specific person, right? So we did a lot of work parallelizing all the tasks, but that part, turned out to be a very difficult challenge because you need to find a doctor who's willing to put pretty much their entire career on the line, because there's still a lot of risk associated with these things. Yeah, to say, okay, I am responsible for this trial, not the sponsor, not the biotech company, but I, the doctor. And then, of course, getting the approval from the FDA to proceed was a really big milestone. And then I think, the dose escalations were little mini milestones on their own, but there was a lot of breath holding for each one.
I figured that the FDA thing would probably be one of your biggest obstacles that you'd encounter. Do you have any lessons learned from that or words of wisdom to share to everyone who knows that's in their future?
So I would say, find a good consultant. I think the two biggest components of your team are going to be your sponsor investigator. If you have the N of 1, pathway. Not everybody does, and that's beyond me, right? If the N of 1 pathway is open to you, as it is for, I think, Cure Rare Disease had it for a gene therapy. ASOs have their own draft guidance, and N of 1, repurposing trials have been run all the time. So there is an N of 1 path, and if you can make it somehow work for you, that's probably the best way to go. And in that situation, having a doctor who is, kind of your child's hero, right? They have to be really, really invested in your child getting this trial. That is probably the most critical piece.
So make friends, make them care, tell your story.
It turns out that this is all incredibly difficult. So we want people on your team who are going to stick with it, so you're going to stick with it because it's your child, or I'm going to stick with it because it's my child, but everybody else is busy or they have this or they have that. And so the most critical thing turned out to be can we make that connection where the other person really got it and took it all on almost as if they were their own child. And that's a lot to ask for, right? But I hope the FDA could, in some way, take on that mindset that, okay, this is someone's child. Maybe whoever the reviewer at the FDA is, if they could think this is my child facing this, what would I do if I were my child, right? And I don't know if the FDA listens to this, but if they did, please hear it from the parents, and that's what they want.
There are several FDA people who listen to it, so I think they heard it. Well, and it makes me think, too, what Ethan Perlstein always says, right, is that the parent is going to be literally the best business partner that you're ever going to have moving forward, because they're never going to get up and they're never going to give up, and they're going to be the most motivated people involved in the entire project from start to finish.
Absolutely. Yeah. I mean, most motivated, and the motivation is the purest, right? There's no profit, there's no ego, there's no nothing. It's I want what's best for my child. I would hope that, that aligns exactly with what FDA wants. They want what's best for the patients, right? They have a huge mandate to, regulate all of, everything that they regulate. But at the end of the day, the patients are at the middle of this, and the parents are advocating on behalf of their patients. I mean, the patients themselves too, but, for the children, it's the parents.
So how did you feel when Leo was first dosed with his custom treatment? What was that like?
Terrifying most of all, I think. I think, I have this, what are well-worn wagon wheels in my brain, thinking oh my God, he could get hurt by this, right? And then I would be we're proceeding because, all the evidence, blah, 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 science, blah, 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 rationality. And then, we're going because we know, all of the reasoning that we wrote down a million times and stuff. But then, the lizard brain in the back of my head is oh my God, he could get hurt. And the rational brain is you're doing this because of a gazillion reasons. And they're just having this weird, argument constantly. And I think I'm just sitting there waiting for them to come out, to either get me or tell me, oh my God, we had a reaction that was unexpected. So I think the nervousness died down as nothing happened. And eventually, I think 2 or 3 hours in, they came and got me and said, okay, you can see him now. And, nothing, everything went without a hitch. And I was this is amazing. And then, there's a groggy Leo, but.
Yeah. So good, no bad things for immediate results. Can you maybe elaborate on potential signs of efficacy that you've seen since Leo's had the treatment?
Yeah. It's a bit tricky because like we saw the best signs of efficacy during and immediately after the dose escalation, where he was getting it very frequently, so like once a month. And I think in the last 2 months, 3 months of that, we were seeing him, he gained a lot of gross motor strength. So we went from poor head control. So like he had some here or there and he could hold his head up for at most a minute, maybe two, to being able to hold his head up for like 10 or 20 minutes, right? And being able to support himself in a tripod position, whereas before that, he had always been very, very floppy. So like even at 18 months, 20 months old, he was only rolling sometimes. And if you tried to sit him up, it was like a bag of rice. There was no attempt to hold himself up. Whereas now he would bear weight. He would also be able to, I think, just like hold his attention on me or his sister or his family members for much longer periods of time. And so I think, one important piece of context is, what does the prognosis look like without an intervention? And what we were seeing was, he was bouncing around developmentally between, say, like 0 and 4 months of age, right? So like we would make a little bit of gains, like rolling or laughing or, I don't know, tracking, even following an object that we were moving in front of him. That was a skill, right? That was developmental skill. And we would hit some regressions. And so we would have been working on all of these skills. And then, he would get sick and then we would see seizures and we would see developmental regression. So that's where we're at. So like these gains I'm describing they sound like, big deal or whatever. But like for him, it really was a big change over the baseline.
Yeah.
So like since then, we've been on these 3-month dosing intervals and it's been much more challenging. Good news is that the FDA finally allowed us to go for much more frequent dosing. So they let us have the dosing interval, and we're excited to, hopefully see more compounded gains for him.
That's amazing. Yeah. And I think everyone can 100% relate to all of the things you described in his development and his regression, the getting sick and all of the stuff. And even just noticing what maybe seems small to other people, like a little bit more awareness, is such a huge milestone. And that's amazing to see. Have you been concerned at all? Have you seen anything that you've had to address safety-wise?
Safety-wise, no. I think, our trial has all of these tests, like they measure all kinds of markers, like in his blood and his CSF, in his urine. None of that has picked up, and in his MRI, right? So I think my hydrocephalus is one of the like kind of most recent risk factors. So we haven't seen any on any of the indicators, and watching him day to day, we also haven't noticed anything out of the ordinary. So fingers crossed that it'll continue through the higher dosing intervals. But we're really happy that I think I was going to be extremely grateful no matter what happened, but the most important thing was that he doesn't get hurt and, both set us back and set, possibly other programs back. But, we don't see anything of that sort.
So fabulous. How do you see the success of Leo's treatment influencing, other N-of-1 projects?
I really hope that it gives people the confidence to proceed. And, the FDA, the latitude or confidence to allow more people to proceed. Because, there's not so many cases out there. And, every setback, I think, the field is a little overcautious. So, like, none of us, especially the parents, want to be careless with this. We're only, we all are kind of feel a very strong urgency to proceed because we see the true kind of risks and the day-to-day of the diseases. And so I hope that people will feel more encouraged to proceed. And if there are, side effects, that we not overreact, to them.
I'm looking forward to learning about the significance and the goals of Project Baby Lion. Can you tell us about that and maybe even what inspired its name?
Sure. Project Baby Lion. So the idea is like, I can share my story. I can share, one of the goals is to publish the IND. So I can share what we've learned and try to help others that way. And then, that helps to an extent, right? But at the end of the day, there's more that we could do. And so I guess what I thought was, well, how do I try to, take what I've learned and do it again better? And that's kind of what Project Baby Lion is attempting to do. And to also do what I did, but do it in a more sustainable and systematic way. So the first phase is to do diagnostics, and I think we can do diagnostics better because Leo was diagnosed at 4.5 months old. And that's 4.5 months that could be saved off of a diagnostic odyssey. And, I think the idea is that we want to combine sustainability with urgency, and that's not easy, right? And so that's where we start with this NICU sequencing. I know you had Dr. Stephen Kingsmore on a few weeks ago, and we're working with Dr. Stephen Kingsmore to use his rapid whole genome sequence test because it's been proven through many studies to be economically scalable, right? And that's amazing if you think about it, because ultra rare is supposed to be this economic graveyard, right? There's no way to make things sustainable. Everybody's like trying to raise money and but somehow this rapid sequencing is not only clinically, amazing, but it's also economically, positive ROI. The story is because, you're saving healthcare resources that are, going to the wrong interventions if you don't know, the root cause, right? So let's be smarter and do the right thing, or at least not do the wrong thing and waste a bunch of money doing that. And then so now if you get a bunch of patients who are being diagnosed at birth, I think there is a possibility, an opportunity to make an intervention and administer it, let's say before they're 12 months old. And I know like there's Combined Brain is out there, and everybody seems to understand that, urgency is very important for these neurodevelopmental and neurodegenerative diseases, right? So between 0 and 24 months, 36 months of age is enormous brain development. And so the difference between intervening, say at 6, 12, 18 months of age is going to be huge. And so, can we intervene at a time where we can make a very big difference in a child's life, in a person's life? And that's where we hope to be able to prove with data the potential sustainability of these kind of personalized therapeutics for these ultra rare populations.
Amen to that. Can you clarify for me? So is Project Baby Lion specifically looking for TNP02 mutations from the rapid whole genome sequencing, or is it also going to be plucking out all of those rare diseases that don't necessarily have a treatment, so they aren't going to get told if they have the whole genome sequencing in the NICU, and then, try to make a path forward to get a precision treatment in that first year? Is that what you mean?
Yeah, so I should clarify that. So we are, disease agnostic. That said, we are not taking on the mantle of all ultra rare diseases. We are trying to give families a diagnosis at the earliest possible, time point, which is the NICU, their first NICU admission. And then, what happens from there on, it depends on the case. So there are the luckiest patients who have some FDA approved therapy, and that's great. Then there's the clinical trial space. We'll try to connect patients with, the most appropriate trial if that's possible. And then, when we exhaust kind of those more standard options, we want to connect patients with existing foundations that are already out there, right? There's so many amazing patient-led advocacy groups and research foundations. So we want to connect those patients, with their homes, right, with their communities. And then, when we hit the so-called N of 1 space where there's really nothing out there because you're the first or second patient, then we will, fundraising is always difficult, is a challenge, but we will try to put together a very, very rapid program. We do have to be very selective about the patients because, the family has to be on board, the disease has to have, it has to be severe, enough, and we have to be able to, develop the therapeutic in time. But that's the goal and that's the idea. And as everything, the vision is limited by the funding.
Well, that's really amazing. And kudos to you for doing that, because it's frustrating that the NICU whole genome sequencing situation at this point is only going to inform families of the genetic reports that have a treatment, right? And then the other ones just aren't going to find out until they find out later. So I don't really understand that gap whatsoever. So it sounds like this could probably potentially fill that.
Yeah. What's also frustrating is that this rapid whole genome sequencing, it's not standard of care yet. It just, these things take time to percolate, through the entire healthcare system. And so that's also part of our kind of push for equity, right? Equity is such a big challenge in rare disease as well. And we're saying, okay, let's spread this practice to kind of all NICUs, and let's try to treat the patients that get diagnosed, with equity, which is, only the science and only, the what's available out there, that should be the only determination.
Do you have any success stories or milestones yet that you've achieved with Project Baby Lion?
We're at the very beginning. So we're about to launch it. So we're going to start to sequence. We have a small pilot and we're about to sequence 20 patients. So we don't have success stories yet, but we're hoping, for them to come. And I think if patient advocacy groups are listening, if you get an email from us or if you get a call, please please pick up, because there's a baby at the other end who could use your help, right? Who could use your expertise and what you've made.
Yeah, so maybe there's a call to action here too, to connect with the patient advocacy orgs that are definitely at least active on social media and through Global Genes and Nord, who are listed. So maybe there's some way that you can send out a call sign here, even through Once Upon a Gene, to get them on your radar, for sure.
Absolutely.
Are you doing anything at a specific location for your first 20 patients? Like, is it at a hospital? How are you picking the first 20 in terms of who's getting a genetic test?
We're working with Stony Brook University. And so that's not one of the traditional, genomic academic medical centers. So that's the other side of this, is that's where Leo got a lot of his care, right? Outside of Boston Children's or Children's Mercy or Columbia, where have you, or even Rady, right? These are the premier institutions. Outside of these academic medical centers, genetics, clinical practice, and genetics research, it's not spread evenly, right, across geographically. So we would like to, do our part in raising awareness among the professional medical community that, that sequencing is here as medical practice. So that's, we're partnering with both Rady and Stony Brook. And that's where we're starting out, because you need a hospital, you need a NICU to do this. And so that's our partner.
For sure. I have an argument to that, because this is what I've been hearing for years in every call and every presentation I've ever seen, is we have to educate the clinicians and the doctors on genetic testing. And I'm at a point to where I'm like, this is taking too long. There's too much bureaucracy and red tape. Why don't we just educate the parents to request what they need?
Yes, we absolutely, the parents absolutely should request what they need. I think it's we should push on both rocks at the same time, because like, as a parent, I've gone to the doctors many times and they're just like, okay, they're barely listening. Sometimes they're listening. Sometimes they're, they're just like, okay, you're the mom, your child is sick, you're emotional, you're this or that. And I'm just like, okay, I think that's where I first learned to take a deep breath and be like, okay, how do I present myself in a way that they will have to take me seriously, right? And so I think we should try to educate both communities, because yes, the doctors are, they're not the only people who have a voice. On the other hand, we can't throw parents into the wood chipper of doctors not taking them seriously. So if we could, reach both people, and then the parents will talk to the doctors and the doctors will listen to the parents, and, maybe we'll have more diagnoses.
Yes, lift both rocks. Well, I love this. I think it's a really forward-thinking initiative, and I very much appreciate it. So thanks for taking on 900 more jobs on top of what you've already accomplished and what you're doing. I guess I would love to know, like, how you see this evolve, all of your projects, including Leo's therapy and N of One work that you're doing, and the TNP02 Foundation. Like, how do you see it evolving, and maybe what are some of your upcoming goals for the future?
I think, the most helpful thing that would come out of Leo's trial is the sharing of the data, of the IND, of the clinical protocol, of all of his like lab work numbers, so that other families, other foundations have a blueprint and know that A, this is possible, and B, what it looks like in practice. And I know there's a lot of people say they want to share data, they want to share this or that, but we want to put our data where our mouth is. So our PI is on board with sharing the protocol, and Crayon is on board with sharing the IND, or, in some sense, it's our IND. It's unclear who exactly owns the IND, but there is an annoying thing of we do have to redact it for IP that is not ours, that is not Crayon's, that is not, that is not the PI. So there are certain IP issues, but we have to go through hundreds and maybe thousands of pages of documents to clearly, X out whatever's not ours to share and give away. But after that, we want to, definitely publish this document that, it seems to like gatekeep so many people from, moving forward.
Yes.
Yeah. So I hope that'll catalyze, a bigger culture of sharing and actually doing it. For the Baby Lion project, I'm hoping that we can attract, investment and interest from biomedical research, like from the industry, right? Because like it's a really hard problem, and I hope investors and the big shots, they look at this space and they should think like, wow, I'm a big shot. Maybe I can solve this problem, because it's a really big problem. It's a challenge, and it's worth doing, right? Our children are worth it. They're worth the work that we put in. And it's hard, right? It's not one of those easy, like, I'm going to make, no offense to like the tech people, but like, I'm going to make a software as a service, company. That's kind of like, that's kind of easy, right? People know how to do that. Well, this is hard. So, the people out there, we're trying to solve a hard problem. So, join us or, stand up your own solution, whatever it is, this is what the children need, is people working on, a very, very challenging problem.
Yeah, you heard that, big shots. Iwi's calling in all of you. Because remember what we also said as parents, as partners.
Yeah.
We also need a catchy slogan for your put your data where your mouth is. So I'm going to noodle that one for you, Iwi.
Okay.
All right. Well, do you have any words of encouragement for families, or a message that you really hope to convey to parents who are kind of going through the work?
Don't be discouraged. It's so hard. And our family had so much help. We had so much help from so many places. And, ultimately that's what got us, this far, this fast. So don't be discouraged by the progress that others are making, right? 4 years ago, I was in a very different place in life, or maybe I guess it's more like 6 years ago, but like I would not have been able to do this for, 6 years ago. And like a lot of lucky circumstances had to kind of, the stars had to align, right? So not every family and not every foundation can be lucky. And even if you're not lucky, like hard work, will pay off eventually. And, I think a lot of us are working to kind of shorten this process, so that this is the saying that if it's not for your child, it's for the next child. Well, I think, things are changing enough so that, as a field, we're trying to make it so that it could be for your child. So keep fighting, and take care of yourselves, right? That's something that I've struggled with throughout this journey. But, we'll get there slowly.
Thank you so much for all of that. I appreciate you. Is there anything that I didn't ask you, Iwi, that I should have, or that you wanted to mention?
No, I just, I do want to say, like, I love your podcast. When this started, being able to listen to others through your podcast was such a, I don't know, it was so helpful. And supportive, that, thank you for doing this.
Oh my gosh. Thank you so much for telling me that. I really appreciate it. And you're so welcome. And like you, I know that like we need all the help we can get. We need our community, and we have to share all of this stuff no matter what, even if it's for the next generation. And especially for the next generation. It has to be better. Okay, well, thanks for joining me, Iwi. I look forward to sharing our conversation.
Thank you.
I hope you've been enjoying this podcast. If you like what you hear, please share this show with your people, and please make sure to rate and review it on iTunes or wherever you get your podcasts. You can also head over to Instagram, Facebook, and Twitter to connect with me and stay updated on the show. If you're interested in sharing your story, or if you have anything you would like to contribute, please submit it to my website at effieparks.com. Thank you so much for listening to the show and for supporting me along the way. I appreciate y'all so much. I don't know what kind of day you're having, but if you need a little pick-me-up, Ford's got you.